I was inspired to write, or rather revise, this textbook because it seemed to me a wonderful opportunity to be involved in a research text. My students are terribly enthusiastic. My past students in particular have been very enthusiastic about research, and so I particularly wanted to revise a text that they would find would be of value to them. The thing that I'm most proud of in this book is that we've taken a very focused approach to the content, but we've also maintained the integrity of the content. So whilst the book is less in volume than the previous editions, we have maintained the most appropriate content that's needed in order for students to guide their learning. I believe that the value of this text is the applicability or the usefulness of this as a sound resource for teaching from undergraduate through to master's level. The content of this book is presented in an easy-to-read format. It's broken up by activities, so it's not too dense for the students to read. They're able to then use this content in order to develop their knowledge further in order to meet the assessment that will be required within the unit of study they're undertaking. This book is different to other resources available for research units. Firstly, it's an Australian text, and we use primarily Australian research as examples within the text and also within the references. So we focus very much on putting Australian nursing research forward, which can only facilitate learning of research for students. The other thing is it's comprehensive enough without being too dense for student learning. And I know that students sometimes find it very difficult where they're confronted with pages and pages of text. So the fact that we've broken our text up with activities and all sorts of other tips and so forth make it a much more user-friendly resource for students. The major challenge, I believe, in teaching research is in engaging the student, especially at undergraduate level. Now, not all students immediately see the value of studying research, and so to keep them interested whilst providing the content that they need in order to complete the unit is a major challenge for anyone teaching research. The other thing is in providing examples that they can immediately see transposed into the area of clinical practice, and that's a challenge in finding those and finding Australian research that addresses those. This textbook is a resource for lecturers that is across all requirements for a research unit. It's visually appealing for students as well, which means that students will take this resource with them and work from it. That's very important when you're wanting to teach a unit. The other thing that we provide are the research activities that are contained within the book, case studies, and so forth, which a lecturer can then use in any innovative way that they choose to for class presentations, in tutorials, and in fact perhaps using it as part of their assessment criteria. The Search Me activity, which is an online activity, is another resource. There are within each chapter activities directed for Search Me, and students can then be directed to do this as independent learning or perhaps even as part of their assessment for the unit. The Instructor's Manual is another excellent resource for the lecturer, as it provides, if you like, a lesson plan that the instructor can then take using each chapter as a book for their lesson. Each chapter also provides responses to the activities that students are able to undertake, and more particularly, what it does, it provides examples of how the objectives for each of these chapters can then be related to the clinical area. And I believe this is a very important thing for students to be able to see the relevance of research and how it does impact upon education and their practice area. Not all nurses need to be researchers, but they do need to be consumers of research. So it is very important, but also very exciting for us, that we are able to provide these nurses with the skills as we teach them, evidence-based practice and evidence-based knowledge, so that they're able to take this knowledge, they're able to apply it into the clinical setting and to their particular patient profile. And so it's very important that we address this comprehensively, which we do in this textbook, so that we are part of this evidence-based practice movement, and knowing that we are providing nurses with the skills in order to do this to increase all patient care.